Good morning. It's Monday morning, and I've got the pleasure of starting my week with Katie and Scott. And this is one of the episode 5 of the Creating the Conditions videos that Scott Hartley and I have been doing over the last few months to help people to translate the learning from all of our work into action and practice. And today we are going to be talking about that in a really kind of focused way. Actually, it is about recognizing that we've got and we're getting all the time more and more evaluation and evidence, and we are working at trying to ensure that that gets translated into our practice, into our mindsets, into our approach for our teams and our partners across the places that we're working in. And we all bring a slightly different perspective to this. I'm going to ask Katie and Scott to introduce themselves, and then we'll have a look at why does this matter? Why does it matter to each of us that this evidence evaluation does get translated into different action and practice in our work? And I'm going to just dive in. It'll be a free-flowing conversation, and we'll see where it goes. But it's really good to see you two this morning. Try and just introduce yourselves and to say why this kind of matters to you and what brings you to the conversation. And then I've got 3 brief slides that we'll just point to, and then we'll take those down and we'll carry on the conversation and see where it takes us from there. So Scott, I'll come to you first because this is episode 5, and with that we're only going to do one and test it out, and here we are. So good morning, and
morning.
Introduce yourself.
Morning, I'm Scott Hartley, Director of Press Red, and it's early on a Monday morning, and we're trying to think this through or talk about it. So I'm looking forward to the conversation. So do you want me to answer the question now, or shall we let Katie introduce herself?
Let Katie introduce herself and then we can dive in.
Hi everybody, I'm Katie. I'm a researcher at Sheffield Hallam University, and I'm also the kind of lead of the what's called the National Evaluation and Learning Partnership with Sport England.
Okay. And Scott, I should come back to you then. So when we were discussing last week what was next, I think actually when we ended episode 4, we were thinking about, and this was on the list of what might come next, what might feel most helpful, as we've looked at, in previous episodes, why are we working differently? What is that way of working? How do we know what's changing? And what kind of leadership does that take from any of us and all of us? And what is leadership anyway? And then I think we ended episode 4 going, it feels really helpful now to think about really kind of whole systems approaches in place and how we are really translating amazing kind of quality of evaluation and evidence that we're getting through. So you work with obviously lots of, not obviously, you won't necessarily know that, you work with many active partnerships and many organisations around the country in different places. What is it that brings you to this conversation? Why do you think it's important just now?
So I'm going to have to kind of hold my excitement at times, I think, this morning. When we started talking about this particular episode, it really made me start to think about my early days in sports development and what they were like and what it's like now. And the bit that's got me most excited about today is that we're talking about some strong evidence that's emerging from practice over the last few years that's really starting to help us think through how we start to need to act both individually, organisationally and collectively. And so it's real excitement because I could imagine what I'd have been like as a naive young sports development officer all those years working in communities in different parts of Wales, and if I'd have had something like this to try and get my head around, as challenging as that can be, it would have been a really helpful framework, I think. And I think the evidence that we had back then, and I'm not going to reference anything particular, but it wasn't anywhere near as strong as what we've got emerging now, and I just think that's really exciting. I really do. And then obviously the bit in my job is, like you say, Hayley, I'm working with a lot of different partners that are wrestling with this, about particularly wrestling with the shift that they need to enable in their organizations to move from a certain way of practicing to a different way of practicing, and the challenge of that when you've got the organization designed a certain way, the team set up a certain way, doing certain things that are only partly related to this, and there needs to be a shift, and we're working with quite a few organizations in that space.
Oh, I'm holding myself back now from joining in with that. We're just going to bring the slide down a sec, actually, while we're just setting this up, and then we'll bring them up when they're relevant to what we're talking about. But go on, Katie, I'll let you go next.
Yeah, so I think just building on what Scott was saying there, really, I think, thinking about evidence, we've known for decades, really, that our approaches to support more people to be physically active through kind of delivery of physical activity and individualized sort of approaches has had some successes, but hasn't created that shift that we want to see, where population level changes are really occurring. And it's through the investment made in local places, and also supported by Sport England, that it's really given people the opportunity to try to work at a different level, working in different ways to, as you've been talking about in the podcast, in this episode so far, to like shift those conditions. And then it's been my role to really look at what do we mean by evidence in this context. How can we actually gather evidence that is appropriate for the kinds of work that we're trying to do, and then how can we actually make sense of that when so much of the work in the places is really unique and special and sort of different for each of those different places. But it was my conviction that we would be able to find ways of sharing our experiences and our learning of what's working and what's not working across places, even if no two places are the same. So what's brought me here is really just that opportunity to talk a little bit more about my experience of trying to think about methods there, thinking about how we can share that evidence in a way that makes it user friendly and that people can put into practice. And I hold my hands up and know that there's still work to be done there. But it's just really heartening to hear and to witness, when we are working with different places, how they are using some of that emerging evidence and putting it into action, and the journeys that they're starting on now. So just, really good opportunity to sort of take stock and share how far we've come, and also perhaps signal, where we still need to get to.
Thank you. And I guess my reason for knowing this is important just now, but also, sort of it's going to become more and more important and exciting, hopefully. It sort of starts from a similar place as Scott's, which is, and just this weekend I'm writing a book, and it's about this work. And the bit I was in yesterday was right in that space of thinking back over my career and the approaches, like you were saying, Katie, the approaches that we took, certainly probably, I would say up to about 2013, 14 in my career, so probably sort of 15 years or so of sports development work. Using a particular, sports development pathway continuum, the way that we tried to capture what was going on was about measuring throughput and attendances at things and numbers of schools in school game. What was it called? School games, yeah, wasn't it? There were projects and programs, and we had certain ways of measuring and evaluating what their success or otherwise. And then there was this real shift that I was just writing about yesterday, which is about this transition towards a more systemic whole systems, as we would now call it, approach, and the Global Alliance and World Health Organization sort of work around 2011 to 15, I think. I was trying to trace it back to when I was kind of going, oh, right, this is a new way of working. It feels like it holds so much more potential, because we're going to involve, education and transport and planning and all these different sectors in the work. And then you get into, and this was around the time that I transitioned from working in Derbyshire to Greater Manchester, where you're writing a whole different kind of strategy. It's so much more wide ranging. You can't measure it and evaluate it in the way that we had done before. And then feels better, and you can sense that it's taken in a better direction. And then you are searching for a new way of understanding the change that's happening. And not least, you've got boards and funders asking what's changing. So, and this is around the time you and I met, Katie, where I remember thinking, oh, the way of working as evaluator that you could bring to GM Moving, and the previous work that we've done with Scott and the Reevaluation Collective actually had helped me to sort of see there was a different way of understanding what was changing and what difference was being made. Like that had a potential. And so you're working differently, you're starting to evaluate differently. And then for me, I think in particular when I took on the chief exec role in GM Moving, you've got a team and a system and two boards who are all looking at you going, how do I know what do I need to do? How do I need to work? How do I know what difference I'm making? What do I put in my annual performance and development review form, about the value I'm creating in this way of working. So all these dilemmas and questions start to, surface. And I think that's what brings me to this conversation today, is a long way around, is to say that's those kinds of questions now I see and hear all around the country, and actually through the global community of practice. We're seeing that in lots of different countries, not just here. And what's very exciting is that for probably a year ago, for the first time, I felt able to say, we are emerging evidence shows that, that this is what's changing, and this might be why. And there was definitely a tipping point where the early research and evidence and evaluation gathering felt just as experimental as the work itself. And then about a year ago, and I think it was the first time that there was a national kind of picture from the first round of national evaluation, that I started to feel like, oh, actually, that's kind of mirroring and adding to the local evaluations. And that gave us more confidence, if you know what I mean, that was, so it feels like a really important time, because all around the country, people are looking for a way of working, a way of evaluating, measuring, and then translating that learning back into the practice and the action of them and their teams and their partners. So yeah. Should we describe?
I was going to say, Hayley, just building on that though, the reflection that it has taken some time to come to a way of articulating or speaking about this work that makes sense, isn't to be just brushed over. Like the language here and the way that we describe things, this work is absolutely filled with jargon, with words that mean different things to different people. So even just taking the idea of system, there's several different definitions or in people's heads how they think about that. Some people might think about interconnectivity of things, or some people might see system being located at a sort of level of bureaucracy, like the computer says no type system. And I suppose the reason why I just have this slight tangent here is to say that some of the time taken to get to a point where there is an evidence base is because we're talking about ideas and ways of working which aren't like tangibly visible in the world always. It's not like, oh well, you can count the number of people at your venue, or you can count the number of people participating in school sports, because they're there. There's individual units that you can just kind of point to. Whereas when we talk about ways of working to try to get more support for physical activity across different like transport, school, different sectors, for example, like some of these things are quite subtle, some of these things are quite intangible, but nevertheless they're important. And it's then that the sort of language, the definitions, the making these things which we all think implicitly are obvious to us, actually we need to make them explicit, as in we've got to make them clear, we've got to write them down, we've got to make them more concrete in order to start sharing, having a something that we can share ideas about. It doesn't mean that my definition is right, or it just means that we've got something that we can say, well, actually, how does that apply to my work or not? And that, frankly, has taken time, because there aren't, they're not there. You can't just pick them off the shelf and say, right, we're going to use this, because it hasn't been there before. So sorry to sort of tangent there, but I just think that time that it takes and the work put into listening to people's interpretation of what this work is, like what the languages they use, what they mean by that, and asking them to be explicit about what that really looks like in practice, even if you can't see it, it takes some time to sort of get there.
I agree with that. I'll come to you in a second, Scott. I'd be curious to what you're hearing from the people you're working with about what's helping. I think that point that you make about the amount of time, Katie, the other thing that I realised yesterday in this sort of researching back was that it's no time at all. It's no time at all since we started working together to where we are now. And there was I watched a presentation, because I went right back to William Byrd's presentations where he was going around the world, sort of around the country, explaining why inactivity matters. And he did like a whole evolutionary time frame. He did one of those brilliant things where it's like, it's literally 7 minutes since, the digital age, or it's 10 minutes since industrial era, when you look back over the whole of, the evolution of the human race kind of thing. I think we're so impatient, aren't we? We're like, oh, we started working differently, and we need to be able to prove it now. But yeah, so I think that's really important, and to have some common language is the other thing I've just taken from what you say. So there's lots of words we might use, but I think it has helped to, particularly with the work you've brought forward around the national evaluation and learning, to offer a bit of a common framework and language to support people to think about this, even though you could pick at the words. But Scott, where are you now? What are you thinking about?
Well, I was just making a couple of observations on that start of the conversation, really, in the sense of we have had evidence, going back to the pathways and so on and so forth. However, there's been a shift, hasn't there? There's been a significant contextual shift that is enabling better evidence in this space around the outcome and the focus on the outcome of movement has shifted dramatically in that period, in those decades, which is then enabling, in my view, that the use of this, the way that we see the quality of this evidence and the usefulness of this evidence, as because we're focused on that outcome, and I think that's a relatively recent shift. We might have said some of those things for quite a while, but not really meant it. And what I mean, I was for my sins in Sport England when we had sport action zones, which were probably the closest we've been to this space, whatever many years ago that is, a couple of decades, I would have thought. But there was a lot of that evidence was still orientated towards an output measure of 3 times 30. It was still, the delivery system for sport. It was still focused on sport. It was still focused on delivering, enabling better delivery. And I think the shift that we've got now is a greater emphasis on the outcome of movement and then the evidence following that, which I think just creates a richer space, doesn't it? It creates it's led to a shift in the way that we think about evaluation. It's leading to a shift in the way that we think about measurement, in order to be able to observe whether we're building that outcome for future generations. It's subtle in a way, isn't it? And it's kind of happened over time, but it has also changed relatively recently, in some ways, which I think is quite exciting.
Is it worth thinking, for people who don't know the journey that we're talking about here and the kind of what we're actually doing just now? Come back to you, Katie. So just briefly kind of explain what this work is at kind of a national level, how it's, how the evaluation is sort of being done, and how it's, how we so far have started to try and translate that into learning that people can engage with, and perhaps then a reflection of like so far what's going well in that translation job, what are you hearing that people want more of or different?
Yeah. Great, Hayley. Yeah, I think so. The role of the National Evaluation and Learning Partnership, initially our role was to support local places to undertake appropriate evaluation and to support learning in place. And I'll just talk briefly about that, because it's something that I don't want people to lose track of, in the sense that each local system, each local place, is different and does have different people involved in the work. They have different opportunities, they have different constraints. And so there is still a real emphasis in our minds in really empowering and encouraging local places to themselves decide what they want to learn about and what evidence they want to gather to check their own progress. So there's an element of local determination. We're interested in receiving reports on what's important to them, but as far as possible, not to determine what that is for them, because that should be a locally decided thing. And so we've continued to encourage that, and we've also continued to encourage the adoption and embeddedness of local learning cultures and processes. Now, again, these are maybe academic terms here, but by cultures, what I mean is that there is a shared idea in a place that what we're doing is gathering data and evidence in order to aid our decisions and support improvement, not purely just to account for our use of public funds. In fact, our use of evidence for learning is a way of demonstrating accountability, in my view. So that's really important. And part of the reason for that is that even though we are building and accruing an evidence base about what works and what doesn't work in different places, we have to acknowledge that we will never be certain. There's not universal laws here where, if you do A and B, you're always going to get C, because the world isn't like that. It's really complex, which means there's just lots of interacting influences all of the time. You can do your best in one area and something else will come out of the woodwork, like COVID, and it will just change the dynamic. And so it's a shift in mindset around what evidence is and how sure we can be about things, and also then what's it for, and particularly with this idea that local stakeholders and local communities know best. It's really to sort of shift that power towards the places. However, we also, as the National Evaluation and Learning Partnership, have a role to draw out cross-case findings and evidence. So what that means is we need to look across the places and go, are there any common patterns here? Anything that we can learn from and share about, not what always works, but that, typically in certain circumstances, in these contexts, this tends to be, a useful way of working or a useful approach. But in order to do that, we had to work with the local places to really identify sort of common patterns and to sort of bring that to light through stakeholder engagement, but also through the analysing the data that was available and the vast array of different things that people put forward for that. And I think we're going to look at that in a moment in some slides, but I can describe it. That allowed us to kind of, at quite a high level, to recognise that in place-based approaches, there were three sort of key areas of practice. Now, in some places, all of these three areas of practice were there, and sometimes there was a leaning more towards one than the other. And so in this slide here, what we're looking at, these coloured columns, of areas of practice for the short term here. So really what we're identifying is that people across their places were trying to garner support, value and profile of physical activity through working with like the non-traditional sectors. So, you know, if you were coming from a sport and leisure perspective, recognising that sport and leisure sector alone can't create this population level change, and we've got to encourage our colleagues and fellow professionals in schools across health or transport, crime and justice to see the value of physical activity and offer opportunities for physical activity within that context. And then others were recognising that actually the people that we're working with who are currently not able to be active do still have strengths and assets in their communities. And really the efforts could be aligned around building up those strengths and supporting individuals and supporting communities to create the conditions themselves almost to be physically active. And the role of sort of professionals in that context was actually to respond to communities and respond to individuals and say, well, you know, if this is how you want to be active, what's my role in creating an environment in which you can do that, but being led by those communities and individuals within those areas or pockets of deprivation themselves. And then the other area of practice, which was really is also really supported in the academic evidence, is that physical activity or physical activity inequalities in particular are like very much linked to people's actual opportunities in life, you know, like where they live, the quality of their housing, the transport infrastructure, the you know, their opportunities to be well educated or to have meaningful employment. And whereas in the past, with just having a kind of sport development role, you know, it was impossible to think about being able to challenge some of those real problems in place. What we actually saw was that with a place-based lens and an emphasis on working across different, you know, with allies across different professions or different sectors, actually it was a common understanding that we're all trying to work with the same people, and these people have the same, they have root problems, which mean that they are, you know, not able to be active just in the same way as they're not able to eat healthily, or, you know, or you know, might be involved in smoking or other things. So there's an idea really that actually pooling resources to tackle some of those underlying inequalities was a, you know, was a legitimate course of action. So going back to what I was saying earlier, Hayley, is like the what we were able to see when looking across those different places was as a pattern of different practices going on, and being able to kind of recognise those at quite a high level was able to actually start to articulate that these are different ways that might interact ideally, but also different interpretations and ways of working that take it from being an individualised approach to a more systemic approach.
Yeah, it's really helpful. And I guess from my perspective, just sort of briefly thinking about how we can use this evidence, going back to what I said at the beginning, is about, just for example, the fact that tackling structural inequalities is named in the evidence and the research, and that gives me permission, invitation, instruction even, to name that challenge and to push at that thing in our place. So I was just thinking about all the ways that people might use this stuff is, it might be permission, instruction, invitation to think and talk differently about the work you're doing. And then when you get into some of the other stuff in this slide, you know, which won't go through it all because there's other videos that do that, which we can link to this. But I was thinking when you were talking about why is it that we want to learn, you know, what is it for? It's to do better work. It's to make a bigger difference. It's to understand how we need to be to do that work. And it's and sometimes, you know, there is an element which is about it's to maintain and secure future investment into the work so that the work can continue. I think my reflection just in this moment is that for such a long time, and thinking back to previous, you know, sort of decades, where almost like the primary purpose of evaluation and the measurement was for the bit around more money, or that bit of money that they're after. So it was also quite competitive. And the thing I love about this work and this approach to evaluation and learning is it's kind of feels like we're doing it for good reasons, you know, not just to prove ourselves or to secure investment or to be better than the next organisation who's doing it differently, because we're all able to use it and, you know, and translate it and apply it to our work. I'm going to bring that down again for a second. Scott, any reflections on all of that?
Well, I was just, you know, pondering something that Katie said in particular around that shift in mindset about what evidence is, and then you have the practices that actually give people the space to think about the value that they're creating across those three different practices, and that's observing and capturing in a very different way to what we've, you know, historically in the main been encouraged to do. So there's a really important shift there, isn't there, that I think is giving legitimacy to, you know, I think it was with you, Hayley, that we had a conversation about sitting on a children and young people board for years and not really contributing to it or something, and then all of a sudden 5 minutes comes along and the moment arrives for a contribution, and that connection to physical activity and sport all of a sudden comes to life. And I often hear in my work this conversation going on around, well, is there a line of sight to physical activity? And in a way, it almost makes me feel a bit uncomfortable because you might not know it, it might not be so observable right now that there is a line of sight to it. But we do need to be sat in some of those spaces that Katie's already referenced, you know, those different parts that we know all impact on the influences of whether we move, whether that's community safety or transport planning, whatever it might be. But you might have to sit there for a while.
Yeah.
You might have to build legitimacy. You might have to build trust. And I'm seeing more of that now, certainly across the partners that we have the privilege to work with. And so that and it's because of that mindset shift around what evidence is that's giving legitimacy to some of that now. So for organizations are starting to think, well, we should do that. But we then still tend to fall into that trap of, has it changed now? Has it changed now? Has it changed now? And, you know, it could be 5 years when that moment comes, couldn't it? But you need to be around the table to be able to get to the moment. And I think that there's a really interesting bit there. I'll pipe down now, sorry.
No, Scott, I was just going to build on what you're saying there, because I think there's two things I'd like to just sort of clarify from my point of view. The line of sight to physical activity, and we use lots of different phrases, and it goes back to the language issue as well. But obviously I'm an academic and I come from an academic perspective, and so I'm quite comfortable with sort of academic terms around methods and what have you. But I know that that's not that helpful for other people. But what we really mean by that is that is to be intentional in our work. So you've just articulated there that, you know we need to be around the table in X, Y, and Z. And I suppose what we're asking is not that we want you to articulate a sort of time plan, like, and then after 3 months this is going to happen, then 6 months this is going to happen, then in 2 years that's going to happen, but more to say, you know, my rationale for being in the, you know, the children's wellbeing boards, sorry if that was what you mentioned, or something equivalent, is that, you know, we have good evidence that we draw on to know that if physical activity is part of children's lives, then A, they're more physically active, but B, they have more flourishing lives altogether. And my role here is to build relationships, garner rapport, and find out how within that network and how within that set of policy and practices I can best introduce opportunities for physical activity, as opposed to in the past thinking, oh my goodness, I've got a year to, you know, to deliver my project into schools, and so I've just got to do it now. It doesn't almost matter like how it gets done, so long as we can do it. And you get to the end of the year and okay, you might have delivered the results of the projects, but nothing carries on. There's no substantial change within that school environment. So this is what when we say the line of sight to physical activity, it's not necessarily looking for a timeline, but it's just being intentional and being able to be more explicit perhaps as to why that's a legitimate use of your time. And one of the things that, having recognised the importance of building those relationships and those collaborative partnerships, and then articulating those and putting those into the conditions of change, means that work towards those conditions and maturing those conditions becomes not just something that that is part of the work, and it's recognised part of the work, because we have learned that it does take time, and it's not a straightforward thing. You can't just magically create collaborative partnerships from somewhere. It's got to have that time associated with it. And we've learned that, by and large, it does take months and sometimes years to get there. And so being able to say that is a legitimate short-term, I say short-term in inverted commas actually, but short-term outcome leading towards the longer-term outcomes that we're interested in, allows us to sort of build an evidence base, not only about whether or not those are occurring, but how they're occurring and whether they're occurring in certain circumstances or not. And that's a source of learning too. So what you learn in the Children's Wellbeing Board might translate to an ageing network, or might not, as the case may be. But that's the kind of evidence that we're trying to understand. How do we build these partnerships? What's the function and the processes involved, as opposed to what's the project or the form of it that needs to be translated into different places.
The combination of those factors is the important bit for me, Katie, in the sense of my referencing of use of that term was from hearing senior people in some of the partners that we work trying to say there is, it's not immediate, it's not happening, we're not, it's not happening quick enough, it's not clear enough, direct enough that we can go to shift the outcome. So the whole connection of time and influence and connectivity and that and the connection to actually I need to just be in that space for now, because A, I've got to learn, B, I've got to build trust, and C, there might become an opportunity when we get our moment to make the case for why we should act together. So the two things go together, don't they, really nicely, that I think that we're learning and seeing. But I do on occasion hear that phrase used as things aren't quick enough. Things aren't going to happen immediately because the line of sight is not there, is not short enough. And I just think we need to just be conscious of that.
To add to that, and I think this is so it's particularly relevant for me at the moment as our team come to the end of their kind of year, and you look at your journey over the year and your development review, and I was wondering if we might spend the whole of the rest of this time talking about the different anxieties that come out in the work and in the organisations and in government and funders in this, but that could be a whole other podcast. The thing that is relevant to what you're saying there about line of sight is, I think there's two things. There's a line of sight to the change and the outcome, and the other anxiety comes around the line of sight between my contribution and that change. And so I had a couple of conversations giving 360 feedback to colleagues last week, where I was observing that as the chief exec of the organisation, I see bits of directly visible bits of their work, so I can give them direct feedback on what I see, feel, and hear in my interactions with them. And then I see change in the part of the system that they're working, and I have no idea really what they've done in those rooms over the last 3, 4, 5 years. But I can observe that part of the system is changing, or that organisation is changing. And I think what's helpful with the evidence evaluation stuff is helping us to the more senior and the board, there's work to do, I think, to help boards and senior leaders who aren't in these workshops and webinars and stuff to understand this to the extent that they can provide some kind of reassurance and actually like meaningful understanding of this process. Because if you're doing this work and holding your nerve and you're reading all this stuff and you're translating it into how you need to be and what kind of work you're doing, but you've got a manager or a chief exec or a board who don't understand this learning, they're going to be asking you really different questions, and then you're going to have anxiety, and there's dissonance there between what you understand to be the work and what they understand to be the work. And I think that I can do that for our team because I've been on this whole journey with this place, but I know we haven't got those conditions everywhere, and like the reassurance I can give to people to say, don't worry if it's invisible. You know, we can look at your behaviors, your mindsets, your ways of working, we can make visible some of the tangible changes that you are more directly responsible for, and we can appreciate and praise and reward them. But you need to sort of let go of that long-term change in the system. We will never be able to say it's because of you or our organization, in a really direct way. So I think that's a really important point. And perhaps I don't want to take us down the rabbit hole, causality and attribution and all those kinds of lines of questions, but Kate, you can see you nodding. Is there anything just to sort of finish that bit off, and then we'll think, well, what else?
Yeah, I think, well, two things. One is, whilst it's not the same in terms of a classic experiment, cause and effect, it's not the same type of way of demonstrating the influence of the work. We can work towards making more explicit what we think our contribution is to that change, and gathering evidence that gives us increasing confidence that change is, we have had an influence, or we have contributed to it, either individually or as an organisation or as a partnership. And so it's an exercise, and it always sounds quite quite apologetic, but it's sort of an exercise in building plausible, confidence that we've contributed to changes observed. But the reality, as we understand it in this complex system with lots of different influences, is that is appropriate argument to be making. I would be more skeptical if people were coming and saying, we've seen this change and it's definitely because of our work, with no evidence to explain that, all of the interactions that have led to it. That to me is more risky, and puts you on more dangerous ground than if you've got a way of articulating how you think your contribution has led to that change, and also recognise all the other contributions. I mean, that's the sort of holy grail in my book. Yeah. But what it means in terms of evidence is supporting, is recognising that is helping your teams and your colleagues to recognise that actually data can come from anywhere. So their own reflections on their work, people, I remember talking with you, Hayley, very early on, GM moving Greater Sport, as was, had to do quite a lot of pushing out to places to get them to, arrange meetings or include you in boards or what have you. And then there was a shift where, suddenly there's lots of incoming and inquiries coming to Greater Sport, Greater Moving, to get involved in things about physical activity, but also things about how do we work differently, and, and that in itself is evidence of a systemic shift and a change where you're it's not just come from Greater Manchester Moving as a direct organisation or as a movement. There's a shift in the places as well, but they recognised your organisation or your partnership as being someone who's got something to say about this. And so I suppose what I'm saying is that the data you might collect, evidence,
and there's a balance. There's a balance to strike. What I say to the team is I don't want to spend their whole time capturing evidence of their contribution either. There's some great methods you can use, but you don't want to. You need to do the work and do enough, to understand it.
We might agree to
all
disagree,
your time.
We might agree to disagree. All I would say is that it's just that idea that evaluation, gathering data, can be part of everybody's role, and you don't necessarily need somebody else to verify, or it's useful to have independent observers, etc., and a range of data to help secure your understanding whether that change or that outcome really has occurred. But everyone has a role to play in capturing that data, because some of it's very subtle, and you only notice.
That's how you make that part of your ongoing way, capturing it as you go, kind of thing. Scott, what are you thinking? Or take us somewhere else if you're getting bored of this thing that you've said.
I know, I wasn't getting bored. I was pondering that the shift that I think we see, Press Red see in the number of organisations that are genuinely wrestling with how do they observe themselves differently, and therefore how do they organise themselves differently based on the back of this evidence, which I think is really positive, really positive. I still think there is a challenge there. There's still a gap, especially with some partners that are a bit further away from working in this way of trying to articulate that to, you touched on the issue earlier, Hayley, boards, funders, decision makers, that they may receive investment from. There's still a space, some way to go there. It's shifting. It's the really positive bit of this is that it's definitely shifting, and so there's some work to do, isn't there, to keep pushing what that looks like, how we start to express what that looks like to boards in particular, and there's a whole space there for us to think about what that learning looks like.
I think that's another episode, Hayley.
This always happens,
definitely.
Katie.
We always end up with a long list of other things we need to talk about. Yeah, definitely.
I think there's just on that, there's boards are traditionally appointed, aren't they, to kind of perhaps offer advice or to hold to account, or and it can often turn into a bit of a reporting mechanism, them signing things off. And being bold, what this way of working, whole systems place-based, relational, adaptive, by which I mean it changes over time, kind of signifies is that everybody in a place is implicated and is part of it, including board members, who quite often come from those places, not always obviously, and B, that they have a role to play in responding to evidence and seeing how it affects their own work, both as a board member, but also perhaps as a lead or an influencer in other parts of that place-based system. And I actually think that sort of shift in mindset in terms of what's the board there for, not just to scrutinise, but to respond to, that in itself can create a change into what evidence is useful here. What evidence do I need? What am I looking for? And the two things probably go hand in hand, i.e. the role of the board and then what the accountability frameworks might look like in that context. Again, we don't have a magic bullet here in terms of making that work, but I think there's a shift there that we've seen, again, coming from the evidence from places that where boards do adopt a bit more of an adaptive, responsive mindset, actually how that enables the work to flourish in different ways is also really productive. So it's got a kind of virtuous circle and cycle going on where that is shifting and changing. Whereas when you have a board which is sort of more in a scrutinising accountability kind of perspective, not to say that those things aren't important still, but it's part of a wider picture, then it can actually derail some of those efforts and make people take a bit of a step back and think, I've got to sort of start delivering stuff again, just so that I get the board off my back, that kind of, sort of unhelpful relationship. So yeah, again, I think it's probably.
I think that is definitely a whole other conversation. I could spend the rest of the time describing the journey our board has been on, and it's that virtuous circle is what I have and see and have had for a few years now, and that does create more and more value because the board's role is for definitely holding us to account, scrutiny on organisational indicators of, finance and staff well-being and all those things that you're in more direct control of. They don't try to take control of systemic population scale outcomes, and the board's role is to create conditions for us to play our role at our best, and that has been really helping to be strategic decision makers. So that we should definitely put that on the list of a future podcast. But just in the last sort of 10 minutes, we've got to sit back a minute and think about what else, coming back to the purpose of this one, which is about translating the evidence into action and practice. Is there anything else that you feel like we haven't talked about that feels that's really helping, or that's needed, or that you're hearing people, because things probably don't at the time. So what else? What different? What more? Maybe of you.
So for me, there's a need for us as a National Evaluation and Learning Partnership, both us as a consortium as well as to support others, to provide evidence in a range of different formats. So again, coming from an academic sort of perspective myself, I'm quite comfortable with the idea of setting things out in theories, in diagrams and models, but we've learned, that works for some people, but it really doesn't work for others. And there's a great call for us to provide examples that bring the ideas within those theories or those models to life. And ideally, those examples are articulated by the people who've lived them themselves, and so that they're not sort of like filtered through our academic brains and mindsets and what have you, but they come directly from those people that have experienced it. So last year we ran a series of conditions seminars which talked about the ways of working, but also what we were seeing as sort of more mature system conditions. So for example, like collaborative partnerships. And I think we hit on quite a good sort of balance of a little bit of theory and evidence that was coming from that analysis and that synthesis we've done across lots of data, but then brought to life by the people who've lived that, and the strengths and the weaknesses of how they'd gone forward with things, and then providing opportunities for attendees, people who come into those workshops, to talk to each other about it or how they might put it into their own practice. And this is called evidence to action. And I think that's like a really important step, is that we're not going to come up with the blueprint of how this is going to go, this is going to work. What we're providing is a range of evidence, a range of tools and models to help people reflect on and take forward those ideas, challenge themselves and see how they can put it into practice. And then the cycle goes on, how that lands in one place is going to be different to another. And if they can feed that back to us, we can continually improve our models, our evidence, and it keeps on providing that sort of rich sounding board almost for people to help make decisions in their place. But it is a cycle. And so I think but we still need to work on, other examples, bringing things to life with a range of formats, simplifying the language where possible, or helping people to understand when we are using slightly more abstract language that doesn't necessarily resonate because it's not that tangible, helping people to understand why that's relevant, and so it's the sort of the support that goes around the data and the evidence that should help to enable people to put it into action is what we need to develop over the course of the next few years in a co-productive way. So what I mean by that is where those people can tell us what do they need in what formats, what helps them, then we can make better choices and use of our resources to create that richness for them to work with.
That's a great point. I'll come to you in a second, Scott, as well. Anything different? My reflection on that, Katie, is that we also have a responsibility to use the stuff, and we need sort of a sense of commission, because at its best for me, take things, use them, like apply them, test them out, change them. I've got relationships. I've come to get, oh, am I allowed to change this slide? Am I allowed to put it in this format? I've realised I've got a job to do. I've just started a series of monthly learning sessions in our team because new people are joining the team and they want to catch up on, some of the stuff. And again, I'm in a fortunate position because I've gone on this whole journey, so I can, we've got people in our team who've been here a while, so we're sort of confident to play around with the plasticine, and use it. The other reflection I would offer just before I come to you, Scott, is the writing that I was doing yesterday. I was doing this kind of timeline of the key moments of change in my understanding and my practice, and I realised that all of them had a thing, a visual or a something that was sticky. And maybe that's just my preferences and my learning style. And the light bulbs go on is when I can sort of see something quite accessible and I can translate it and see why it matters to me. And I suppose I remember them because I can point back to them along the timeline of there was the socio-ecological model, there was the COM-B diagram, there was the William Byrd slides, there was these slides and infographics and things that just help things to be sticky things. So, but permission to use them is so important. Scott, for you, what else? What different?
I'm not so sure I've got much to add into that at all. Katie's touched on the language. I was trying to be looking at my notes to try and remember what Katie said earlier, but I can't see it. Maybe I didn't scribble it down. I thought I did, but that concept of people thinking through the change that they're trying to create and articulating that, expressing that, and then thinking about how they capture evidence to show that, and the freedom that gives people with it, and you have a framework to help you think that through. That I think is and if we are giving permission for people to just work that through for you in your circumstances, I think that whole space is just really important to just say, look, go. don't just go. And I do that the bit that's come out here, which I really do think we need to come back about, that the relationship with the board, our conversation, then our ability to influence partners that may invest in us as organizations. I think that's a really important space for us to pick up, because we know that we have been conditioned over many years, and culturally, to think measurement and think numbers, and we need to find a way of keeping that box has been absolutely opened up, and we just need to keep helping more senior people in organizations to think through what that means for the way that they design their organization, and the board, that relationship with the board is a real fundamental in that space. It's been touched on already that we're doing more work. People that are in this for their job are wrestling with it, aren't they? They're wrestling with this evidence that we've got and thinking about what it means to them now. Board members, and people that are just coming in and spending a few days a month, but actually quite influential over decision making, or dip their toe into physical activity for a little bit while they commission. And there's a whole space there that I think we need more examples and more stories and some practicality to it. I think, and if we could surface some of that for people, I think it'd be really, really helpful. Yeah.
Spot on. Episode 6 that will be then. One final thing to add, and I'm just going to ask you for a sentence of something you're excited about or hopeful for to pick up in all this space. The thing I would say to all of that is, it reminds me of 2021, somebody asking for a how-to guide and the resistance, and they're not lack of readiness, I would say, to write the how-to guide. A lot of material out here in all sorts of different forms that is in essence kind of a handrail or a how-to guide for a way of working. And I think it's fine to say people need to get on and play with it and use it and whatever, but we do need to build capability and confidence to do that. And I think all of these tools and resources and podcasts and webinars and stuff has to help people to build that confidence. And I think there's two different. There's people who've worked a certain way for their whole careers have got a different challenge than the ones who I find who are coming in to our team and our work because they want to work like this, but they also still need to build capability and confidence. So there's some of the needs are the same and some of them are different. So that's just a final reflection on that side of things. Did you want to come back just on that, Katie, quickly? And
I mean, just to say that we do have a website which is still really under development and redevelopment, but at the moment there is a series of modules on there. They're short, sort of between 10 and 20 minutes, that sort of talk through very much the basics of an evaluation and learning approach. So we can share a link into that for people who want to just dip their toe in and see how we're encouraging people to evaluate and to learn. And then obviously, as the role of the National Evaluation and Learning Partnership, we're always welcome people to ask us and to share their ideas about how they want to do it and evidence it for themselves. And that is something that we will continue, going forwards, and recognising that people are starting at very different points in their skills and capabilities there, but that they can make improvements. I know we've just got to time, but my final point was that one of the most encouraging things over the last 6 months is that people using some of these tools, these frameworks to talk about the work, it's actually helped them to build their partnerships in place, because there's a kind of common understanding of, we're trying to work with places and people who have experienced multiple deprivation, and this is a kind of way of doing that. So not necessarily to think they need to have all the answers before reaching out to partners, because sometimes some of the solutions and some of the capabilities might be there amongst the partnerships within the place.
Well, that's exciting, yeah. Scott, final things hopeful for, excited about?
I think I'm probably most excited about the pace that this is picking up now. I think that partially driven by investment, partially driven by consent. That this is a legitimate way to start to act and start to think about how you organise yourselves. And I think we're starting to wrestle with some of that really important stuff, aren't we, around how do we start to, back to the board one, how do we start to govern the ungovernable in a way, in the grey space between organisations? How do we start to organise ourselves to govern? And there's some really interesting learning in that space in there that we can probably come back to as well. So I'm quite excited by how this is picking up now. That's the bit that I think's positive. We're going to be overwhelmed by evidence, aren't we, in another 5 years? And so it's just going to be, we're going to just move on, and that's great.
Well, I think, and my thing I'm excited about, I've really started to notice it, is that one, it feels less lonely, because all around the country people are using similar kind of language and ways of thinking, and that framework has given a common language and a shared way of talking about this work. So it feels more like a shared endeavour than it has done in my sort of, last sort of 7 or 8 years working in this area. And in case I think the transferability of this into wider public services for health transformation work, and the readiness of those parts of the system to want it. And there's also a real opportunity to put conditions around the physical activity work and to create that change around tackling structural inequalities and wider reform. So that's really exciting as well. Just to wrap up, I just want to say thanks. It was a great start to Monday morning. Really enjoyed the conversation and look forward to listening back to it and reflecting on it further. So have a great day. Thanks for getting up and being ready. And I'll see you next time for episode 6.
Oh,
take care.
Thanks both. Bye.
Cheers, guys.
Bye.
See you. Bye-bye.